You're listening to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness. Your host is Dr. Emron, an experienced ER physician who has treated thousands of people just like you. Information on the show is not a substitute for professional medical advice. Always talk to your doctor or go to the nearest emergency room with any questions you may have.
Thank you for joining me today on Simple Health Radio. I'm your host, Dr. Emron. On today's episode, we're going to talk about something that is so common that people take it for granted. It's usually a question that the nurse or the doctor asks at every visit, whether it's in the clinic, in the emergency department, or in the hospital. It's a question that gets annoying for a lot of people, and they get very upset when we ask them over and over again about it. The question that we have to ask is, why don't you quit smoking? And that's what we're going to talk about today. Why can't people quit smoking? Why is it such a difficult thing? And what can be done in the future to help people who actually are interested in smoking? So to understand smoking, we have to back up a step. We have to understand that cigarettes are a type of addiction. It's one of the most common addictions in the world, and truthfully, it's actually the most difficult one for most people to give up. A lot of people know addictions as illegal drugs. Some people may be addicted to alcohol. They may have addictions to other things like gambling. But many people minimize smoking cigarettes. It's available everywhere. You can buy them in gas stations and grocery stores. You can buy them in vending machines. The dilemma is that they're so easy to access that the health-related complications are almost expected. On every pack of cigarettes, there's a warning. Every pregnant woman gets counseled about cigarettes. Everyone who's in the hospital gets complicated issues with cigarette use, especially over time. But people keep on smoking. And the reason is that the brain becomes addicted to nicotine, but also there are behavioral factors that go along with smoking. It's more than just acting cool. It's actually something those people have to have every single day in order to function. The dilemma is that the side effects are so serious, and there's no good benefit to really using cigarettes as an addiction or anything to soothe the nerves or to help with your other issues going on in your life. In the United States alone, 480,000 people every year die due to cigarette smoking. The problem is that this is going to continue to get worse over time, even though people are actually smoking less than they did about 20 years ago. What we'll talk about today is some of the resources that are available in the healthcare field, as well as in the state and local level, and also some of the medications that can benefit people who are interested in quitting smoking. The first thing to understand is that how people quit smoking is actually very important. What that means is you can't simply do a cold turkey approach. About 90% of people have tried that. They'll just decide one day, I'm going to quit smoking and never smoke again. The problem, as we mentioned, is that there is a pathway between the nicotine and the brain. When you disrupt that pathway, people go into withdrawal. So, for example, a lot of people on New Year's Day will make a resolution that they're going to give up smoking. Usually 3 or 4 days later, they'll end up in their clinic or their emergency department, or they'll drive their spouses crazy because they're beginning to have withdrawal symptoms already. The common withdrawal symptoms are anxiety, tremors in their hands, difficulty sleeping. Some people have emotional abuse or symptoms that are like anxiety or depression, and they get overwhelmed. So the natural thing for those people to do is start smoking again. That's the only way to calm their nerves. It's interesting that in people who've quit smoking, the average number of relapses is 4. What that means is, at some point, if people do give up smoking altogether, they have tried and failed at least 4 times, and that's just the average. So if you know family members or friends or coworkers who've tried to quit smoking, they did very well for a few weeks or a few months, and then they went back to the cigarettes, that's 1 relapse. And the next time, if they do it again, maybe they get a few more months or almost a few years into it, and then they relapse. That's only 2 relapses. They haven't even made it to the average, which is 4. And that tells you how difficult it is to give up smoking altogether. Now, in every state across the U.S., there are free resources available for people who want to quit smoking. There are toll-free numbers. One of them is called 1-800-QUIT-NOW. I'll have a link to that on our blog as well. What happens with these free programs is that they will send you reminders, they'll send you packages in the mail, and they'll help to encourage you to quit smoking and stay away from the cigarettes going forward. So these are very, very helpful, and they're completely free. Other methods include things like mobile apps. These are little reminders that help to encourage you and help you to stay away from the cigarettes over time. The same idea. If you have your phone with you, it's just a friendly reminder that you're doing well, and then you don't need to go back to the cigarettes. Other people will need some type of medications, and these are divided into over-the-counter medicines or prescription medications. Over-the-counter ones are usually nicotine replacements. Basically, it's a small patch. Sometimes it comes as a gum or as a spray. And what will happen with those is that it cuts down on your cravings. Remember, we talked about nicotine as a direct relationship to the brain. If you cut down on the cravings, you're less likely to reach for a pack of cigarettes or to buy them in the first place. The other medications, which are by prescription only, are basically medications that work on the brain, but in a different way. The common ones include Wellbutrin, which is also an antidepressant, or a medicine called Chantix. Chantix has a lot of success behind it. It has helped millions of people quit smoking. It's something that you can talk to your doctor about. Not every insurance plan will cover it, but if they do, and you want to give it a trial, it's generally recommended to use it on a 1-month basis, see what the response is, talk to your doctor, and then they can decide if they're going to refill it or stop it at that point. There are some side effects with Wellbutrin and Chantix. These can include things like nightmares. They can include some unusual behavior as well, almost like suicidal behavior in some people, but not all. So that's why it's important that your doctor reassesses you. If it's working and you feel well, stay on the medication. If it's not benefiting you as much, or if you get the side effects, talk to your doctor, talk to your pharmacist, and get that adjusted. Now, going forward, the best form of staying away from cigarettes is going to be behavioral therapy. What that means is you need to find something else to do with your time besides smoking. So many people will volunteer, they'll do other jobs, they'll do other things around the house or in their community, and that keeps them away from the cigarettes long term. It also saves them money. As you know, cigarettes are very, very expensive, and the cost of cigarettes continues to rise. There are some people who give up smoking traditional cigarettes and go to vaping. The problem with vaping is that you're actually concentrating the nicotine in even higher doses. And at some point, all 50 states will likely have rules against that, and cigarette use may go down, vaping may go up, but it's actually going to become more expensive as time goes on. So medically speaking, we don't encourage vaping. It's just not anything beneficial. Generally, I recommend people talk to their doctor, especially to get a plan of what they want to do. It's okay if you say you don't want to quit smoking, but your doctor is going to keep on asking you at every visit, your nurses are going to keep on asking you at every visit, and your family will also keep on asking you every time you get a complication like bronchitis, or if you have something abnormal that shows up on a CAT scan or an X-ray. So it's better to give up the smoking early rather than later. If you have other ideas or thoughts, or if you've been very successful in some other plan, please share it with us online. I'll be happy to share that with our followers as well. We have a very active Instagram page. I'll add some additional resources and some of the free toll-free numbers, as well as some of the free medications and other supportive therapy that may be available on our website. I do hope to have you all back on a future episode.
We hope you enjoyed this week's episode. Visit simplehealthradio.com to read the blog, follow links mentioned on this episode, and easily share content with your family and friends. Subscribe to the show on iTunes, Spotify, YouTube, Spreaker, iHeartRadio, and the 3 and Out Radio Network. Be sure to connect with Dr. Emron on Twitter, Facebook, Instagram, Pinterest, and Tumblr to send us your questions and ideas.